Yeah, welcome, dear audience, to this last segment of this special day of the International Security Forum Bonn. It's a pleasure to introduce Professor Michael Meyer-Hermann from the Helmholtz Center in Braunschweig. Following our principle that we need a multidisciplinary approach towards the pandemic, he will be talking and introducing a mathematics approach and talking about the role of modeling and offer that kind of understanding towards the pandemic. That is certainly a complementary perspective to all the legal, political science, social science, and so forth perspectives we had today. Professor Meyer-Hermann is the head of the Department Systems Immunology of the Helmholtz Center for Infection Research in Braunschweig. He studied physics, mathematics, and philosophy, and has accomplished his PhD in theoretical elementary particle physics in Frankfurt. He initiated several research groups on systems immunology, among others in Dresden, Oxford, and in the Frankfurt Institute of Advanced Studies. In addition to developing new methods in theoretical cell biology, his research aims at understanding the interaction of the immune and the nervous system, and mathematical methods as state-of-the-art tool in biology and immunology to improve research of diseases and therapies. So it's a very basic kind of research. During the Corona crisis, Professor Meyer-Hermann advises the Chancellor Merkel and several governments of federal states in Germany based on such mathematical models. Michael, without much further ado, it's a pleasure to listen to you, and we're looking forward to your presentation.
Thank you, Maximilian, for this kind introduction, and I hope everybody can hear me. So the title of my talk today will be Human Agents in Pandemic Scenarios. And I was using this title of an agent for two reasons, because on the one hand, it's describing the methodology that we are using, namely the agents, the agent-based modeling. And on the other hand, it is putting an emphasis on the role of the human in the pandemic. So this is, in order to start with, this is an overview of the early phase of the pandemic, so back in March, where you can see the reproduction number. And if you can see my mouse, you can see that the reproduction number in reaction to the non-pharmaceutical interventions, so the lockdown that we decided there in March, was going down to the critical value of 1 down here. And it means that if you reach 1, that one infected person is infecting another person. So not more than 1. More than 1 means that you will have an exponential growth. Less than 1 means that you will control the pandemic. And when the reproduction number was going down to below 1, we could open. First openings here, then there was a mask duty coming on top, and a second opening here in early May. And this was tolerated by the system. As you can see little reactions here. So the reproduction number went up a little bit, but it was kept below this critical value of 1 over the next month and during the summer. So this is actually, there will be 2 parts of my talk. One is the retrospective thing. What can we learn from what had happened in the first wave, and then evaluating the second wave afterwards. So here the lesson is that contact inhibition measures were efficient. That was also proven by a paper of Viola Priseman, which is cited here, and that to some degree we could open after a successful control of the pandemic. If we were keeping the measures of hygiene and contact measures in terms of masks, for example. So this lockdown that we experienced in March had a huge impact onto economy. So the whole discussion is then, can we actually tolerate to, for the sake of rescuing the health, destroy our economy? So this is just a symbolic thing here, looking at the DAX. you see it's going down dramatically during this lockdown phase, but it recovered also quite quickly, actually. But there is still harm that you can experience in the economy in general. So the question here is, if you think of keeping the death tolls that is induced by the COVID low, you need to do restrictions in the economy and in the society in general. But on the other hand, in order to keep the economy running, you have to relax. So it looks like a contradiction. And what I want to convince you in the following is that it is not a contradiction. So in order to understand that, first we have to see that the pandemic here in 2019 was now inducing 1.5 million deaths globally on this planet. And if you compare that to the 2003 SARS-CoV epidemic, it was just 800 people. Yeah, so that's a huge difference. And so the question is, why is this huge difference? What you can look at is the basic reproduction number, and well, the range is similar. So the reproduction number is actually not the major difference between these two pandemics. So what is the difference? Let's see what the property of the 2003 SARS-CoV epidemic was, the virus. So the viral load peaked 6 to 11 days after symptom onset, and the symptom onset was 2 to 7 days after the actual infection. Plus, it was mostly concentrated on the lower respiratory tract. If you take now the new SARS-CoV-2 virus, the viral load peaks at symptom onset. And this symptom onset is between day 4 and 8. Plus, the tropism is high in the higher respiratory tract. So that has two different implications. The higher part of the respiratory tract means that you are more likely to bring the particles into your surrounding. This is one aspect. Plus, that the viral load peaks at symptom onset means that before symptom onset, you had already a substantial amount of viral load in your organism. This means that you can distribute the virus much more easily because you are not symptomatic, but already contagious. From that perspective, we had to introduce a new model of the pandemic. So this is actually, it's a scheme. I will not go through it in detail, but just telling you that the whole red part here is contributing to the actual infection. The infection means you go from susceptible to exposed, and all of those red compartments here are contributing. This is reflecting that you are able to infect people before being symptomatic. So there is different phases of the infection that already contribute to infecting other people. But the point is, if you have such a model, you can then use it in order to make predictions. So we take here data and we fit this model to those data, and at a certain point we start to make predictions. And we can do predictions with different values of R, of the reproduction number. If you do so, then you can, for example, calculate how long it would take to get the case numbers, the new case numbers per day, down to 300 in whole Germany. And depending on what kind of reproduction number you assume, you will need different times in order to reach this target. So what you can then see is that depending on the reproduction number, you have an increasing time that you need in order to reach this goal. So we have a time period in order to get the numbers down to a controllable level, depending on the reproduction number. We were using this information in order to make an investigation on how this translates into the economic burden of the lockdown that is associated with each reproduction number. Because in order to achieve a certain reproduction number, you have a certain number of measures that you have to take so that every reproduction number corresponds to a certain degree of measures. So let's see what we can do now. Here is the economic activity as it was measured during the lockdown. So there was this breakdown that you can see here in the beginning, stabilization, and this is the partial release of the lockdown that we had. So now we can vary this time period according to how long it takes for different values of the reproduction number. We can vary this time period of how long you stay on this level of a partial release of the lockdown. And afterwards, we have a recovery phase. When you reach the 300 cases, you can release the measures, and you have a recovery phase of the economy. And we do that in a dependence on different sectors. So each line here is corresponding to a different sector. So it's based on survey data. From those survey data in different time points, so we have the survey data from April, May, and June, we can now, for each sector, look how the reproduction number that corresponds to a certain degree of measure corresponds to the economic activity. So for different reproduction numbers at different time points in the pandemic, we can measure the activity of the different sectors. And by that, extrapolate how that would be for reproduction numbers in between. This allows us to make a prediction on how the total economic burden would be depending on which reproduction number we assume, or depending on how strong the measures are imposed. And if you do so, you get this surprising result here. So this is the gross domestic product for the different reproduction numbers in the way calculated in the way I was just explaining. And what you can see is that the loss of economy is least in the region around 0.8 of the reproduction number. So you have to, and the other point is that by that value of 0.8, you have hardly any difference in the total number of COVID deaths. So you can tolerate this comparably high number of reproduction number, even though it's even better if you go down to 0.1, but this is out of range. Yeah, and in this range, you would really have a huge burden on the economy. So the different sectors would not survive this, and this is why you have this huge burden here. But up to the point which is optimal in terms of economy loss, the death toll is not rising. It's rising afterwards for higher values. So having said this, you can say it's just some particular thing that we are looking at. It's not. We were doing a lot of scenarios here and changed different assumptions of the model. And what you can see, this is all the different gray lines. They all say the same thing. You are in this region of 0.8, you have an optimum concerning the costs that are associated with the measures. So is that now just for COVID? No, it's not. If you look back to the Spanish flu of 1918, this analysis here of Correa et al. Was showing a similar thing, namely that higher intensity of non-pharmaceutical interventions was leading to a better recovery of the economy after the pandemic. So having said this, we can now evaluate the current situation. And what we are doing, so this is now the current situation here. This is again the reproduction number. You can see how the second wave was hitting us here. And you can see what we did now by the partial lockdown. We managed to bring it down. We were bringing it down to a value of 1. So what we are doing right now is exactly what we are not supposed to do, namely to keep the numbers on the same level. So every day, if you look on the weekly average, we have in every week we have the same number of new cases per week and 100,000 people. And this is reflecting that we are around this reproduction number of 1 here in this range. So according to what I said before, this is not the optimal value. We have to bring it down here. Yeah? And this is not achieved now, and it's in particular not optimal in terms of economic costs. So let's have a different perspective of what we have experienced in this last second wave of the pandemic. And what you can see here, it's a logarithmic plot. So a straight line means that the number of cases is growing exponentially. And in October, we had a very pure exponential growth. No change in the growth rate. It was very straight. So the straight line is the fit, and the meandering line is the real data. And what you could experience here is that the growth rate was going down. So it's still exponential, but it was flattened around the 30th of October. So already before the actual implementation of the lockdown, which was on 2nd of November. And what that tells you is that this flattening here was not induced by the lockdown itself, but by the communication to the public beforehand. And so afterwards, the second lockdown was inducing a further steepening, further flattening of the curve, and even it's going down a little bit here. So why is it happening that actually the lockdown is having an impact onto the behavior of the people already before the lockdown is actually installed? And you can see it here. This is the change in mobility compared to a year before. It's data from Dirk Brockman. And you can see here it happened already in the same way. The lockdown was decided on the 22nd of March, and this is here. And you can see that at that time, the mobility of the people was already down. So people were anticipating what was happening. And you see the same here again. So already before November, it started to go down. The mobility was going down. And I take now the mobility of the people as a kind of indicator of how the carefulness and the awareness of the situation is. So the behavior of the people is actually anticipating the measures, and it tells you that the behavior of the people is really critical in order to control the pandemic. What we do is to now define agent-based models, and I'm just giving a scheme here. So we model a city. We have agents in households. Children go to school. The second household has an elderly person in the household. People go to the supermarket. Some people go to hospital. Then there is social events here, and people go to work. So all these things happen, and we have, for each person, you have a certain instance in the computer. So this is this person then going somewhere, and for that reason, you know the context between the people. And also you can implement non-pharmaceutical interventions, and by that influence the decisions of the people, where they go, to which nodes they go during the day. So we do that, and we know for every person in the kita, we know where it is, with whom it was. So the total, so in our society in the computer is totally transparent to us. Big Brother is watching you, is in a perfect world here. And so if we do that, we can analyze the reduction of contacts onto the ongoing epidemic in the straight line that we saw in October. So we implement 50% contact reduction in these simulations and see at different time points, and we see that you can flatten the curve by that. You get it to an equilibrium. It's stopping the growth, but it's not bringing down the numbers. It is stopping the growth. And the later you do that, the higher the level is on which you remain. So we are now at a level of something like 150. So we did it quite as precisely as the green line is showing here. If you go to 25% of the contacts remaining, then you can see that you control. So you have to reduce the contacts by more than 50 and probably less than 75% in order to control the pandemic that we experienced in October in the second wave. This is giving you an overview, and I will close with that, on the current situation. So here is the famous incidence that we discuss in Germany. The orange line here is the 50 incidents, so 50 new infections per week and 100,000 people or inhabitants. The points here are the actual data of that we are experiencing now, and the different lines are different simulations. So this dotted line here is what would have happened if we wouldn't have done anything. So the continuation of the October rising of the numbers would have continued like this. And to be honest, I'm extremely happy that we did the lockdown and discussed the measures in order to prevent this situation to happen. But what you can see, as we discussed before, is that people in anticipation of the lockdown that was then decided in the 2nd of November were already reducing their contacts, and to a tremendous amount. Yeah? So it's something like 40%. So we needed to assume that in order to get this bending of the curve reproduced in the simulations. Without the lockdown that then was really implemented, we would have had this dashed line here. So again, we would have a rising number, and the second lockdown was bringing those numbers down and keeping them on this level. However, less than our simulations expected, which is this black line. So in fact, people already relax a little bit. Maybe they were surprised that the lockdown was only a partial lockdown. So there was probably psychological relaxation there, which is shown in this green line, which is increasing the number of contacts beyond having the restaurants and the social events closed. And so this is about the line where we are running now. And it seems that we are not getting out of it. Yeah, so this is why we are now facing this reproduction number of 1 that I showed you before. And so if you see that at the same time the hospitals are running full, there is actually not really a choice than to further strengthen the measures in order to reduce those numbers and bring them down to one of those lines, black or red here. Red is not possible anymore, but it would start a little bit later. And I think there is no way around it, because our hospitals will otherwise get overwhelmed by Christmas. So with that, I want to conclude. There is the very clear statement that pandemic kills people and harms economy, that we have to protect the vulnerable, but in a full-blown pandemic, I don't know of any place where this has worked, that the scientific predictions can help politics to take measures and to also the right dosage of the measure. Health and economy both require an optimal level of measures, and this optimal level is defined by the reproduction number being below 1 in the range of 0.8. That in the current situation, we need more restrictions in order to control and bring the number down. And that the behavior of the population is the critical parameter that is actually making up the whole second wave. Without the loosening in the minds, we wouldn't have had this second wave. So the mutual respect and awareness are, for me, the most critical parameter in those simulations in order to keep our health and our economy running. With that, I would like to thank different cooperators. So in particular, Clemens Fußt from the IFO Institute, Dirk Bockmann from the Institute of Biology at the Humboldt University, and Gerard Krause from my own institute for cooperation and funding from European Union and the BMBF. Thank you very much.
Yeah, thank you so much, Michael, for this very sobering, I have to say, talk. And in that sense, I think it's opening up a very nice window for a last discussion, a last conversation. I would very much welcome questions and interventions from the audience. You can write down your question in the chat room of the panel, and I will just take it into our discussion. We have already a first question. Let me just get there properly. So that question is a quite interesting one, because it's about some of the indicators or factors you are using in this model. It's basically asking, okay, if we replace the economic growth as a factor, and if we replace that with something like cross-national happiness or similar indices, how would that change the equation? If we don't just look for the hard economic numbers, but also if we look for a different set of indicators.
Yeah, that's interesting indeed, but I cannot answer that question because I don't have any knowledge about the happiness. So we are working together with people, for example, like Cornelia Beach, who is measuring in Erfurt, who is measuring exactly this kind of parameters. So happiness is one of those parameters. It is also the awareness and how much you follow the rules and all these things. So she's doing investigations on that. But so if you would now want me to ask the questions, how is the lockdown impacting onto the happiness? This is something that is really hard to measure, I think. But I would be surprised if it would be any different from all the other situations. We have to be aware that the problem is not the lockdown. The problem is the virus. The virus is destroying the economy, our health, and our happiness. Yeah. So, and the only way of getting around it is to install the lockdown so that we can control the virus and reinstall our health, our economy, and our happiness.
I want to raise another question. I find fascinating your work that you collaborate so closely with different disciplines, also economists, for example, to bring together this different expertise. My question would be, where do you see the limits of this kind of modeling approach? What can't you do with the models? To put it a bit more succinctly, why did we get in the second wave, despite having these brilliant models which exactly predict us what's going to be happening? Why did we still end up in a second wave?
Yeah. So actually, the modeling didn't predict the second wave as long as you don't include the behavior of the people into the model. So there is no reason for a second wave if there is actually two reasons that is possible for a second wave. And one reason is the virus is mutating, so that you change the way it is transmitted or the harm that it's producing. This is one way. This is what you experience, for example, in the second wave of the Spanish flu. The other thing is people change their behavior. And we were running through a summer in which we were traveling, we controlled the virus still. People were coming back. Oh, that was a little bit dangerous. But in the end, we controlled even people coming back and being sick. So that was fine still. So in that moment, the majority of people felt secure. And that is the basic mistake that we made. And actually, I'm including myself. I was reacting too late and felt too secure in September, and realized too late that actually we are already in the middle of a second wave, because you have to see that you always react 2 weeks too late. Yeah? So you always see the effect of what you do 2 weeks later. And this is like controlling a ship. It's very difficult to change the direction once you are in the wrong direction.
I think what you just said ties very much into a theme we had all across the entire panels today, namely this theme of what kind of mindset, or how do we change, we will have to change our mindsets, not only to cope with that pandemic, but also for possible future similar events. And of course, the change of mindsets has many different dimensions, but I want to ask you a very specific one, because it seems to me it's very closely related to your field, namely in terms of communicating the results of modeling and the way how models work, especially in an evolving situation where an epidemic is growing exponentially. Where do you see their need for, or also ways to improve the communication, and by that way to change the mindsets of people?
It's a very difficult question, yeah, because what is not really established in this pandemic is this awareness level that we need. So we need the awareness on one hand, and we need a certain respect for the other. So the feeling that you not only protect yourself, but you also protect the others, and behave kind of as if you were sick. And this message is not really in our minds right now. So we are still behaving as if this is just a transient thing, and we have just to come over the next 3 months. And maybe the communication mistake that we did is that we all talk about vaccination, and we think that once the vaccination is there, and now we have at least 3 companies having something enrolled in the FDA, and so there is something coming, right? And so the vaccination will solve everything. It will not. Yeah, we have to be aware of that. So it will not solve everything. On the contrary, we will have to continue our contact reducing measures, even when we managed to vaccinate the people who are doing the transition between the young and the old, plus the old. So, which is probably the priority that we will decide about, because we think that we have to protect those that are at risk first. Once we have done this, this will not change basically the dynamics of the pandemic. So we will have to continue to control the pandemic within the population, even in that situation. And so maybe this was the mistake in the communication, that we always thought we have to just cover this limited time period of maybe a year or so at the most, and then we will solve everything with the vaccination. This is not what will happen, and is maybe a big mistake in the communication.
This is certainly also a very interesting and, of course, tragic irony. As you just said, in a way, we felt too secure, especially maybe in September, October, and that might be true in different countries at a different time frame. During the whole day, we were basically discussing with a mindset to think, how can we improve health security and the nexus between health and security? But now you are saying, actually, we were too secure, at least in our sentiment towards the pandemic. So I think this just points out the intricacies and the problematics of communicating the situation, the epidemic situation, and responding to that. What would be the right behavior and the right mindset of people? But let me move on from that irony and ask you different questions. So if you think about a way forward in 2021, given different factors such as the vaccination kicking in and herd immunity, artificial herd immunity growing slowly, but also, as you just pointed out, maybe compliance issues, because people might again think, okay, now we are secure, now we can just go back to normal. So what is your prediction for 2021? Are we seeing a third wave, or what is your take on that?
So, so there is 2 things. One, so as I said a moment ago, vaccinating the vulnerable part of the population will not change the dynamics of the pandemic. So we will have to vaccinate everybody and hope that there is no side effects. So assuming that this is the case, we will control the pandemic for a while, even though we have to be aware that we don't know how long the immunity lasts that is induced by the current vaccines that are discussed. So there is a time frame of 6 months that is discussed there, and which is limited. And it means, so even though, so it means that in the end, you might be reinfected even though you were vaccinated last year. So let's put it this way. And so there is a certain likelihood that the then induced infection will not be so harmful, but we don't know all that. So this is all not known. In that sense, I don't want to make a prediction. I didn't predict the second wave either. So because, and you asked me for the limitation of modeling. Actually, we cannot model more than 4 weeks in advance. And this is basically because we don't know whether the parameters of the model will change over time. And one of those parameters is the behavior of the people, which we can hardly predict. That's very difficult to predict, this one. And the other one is to predict scientific advance of how long the vaccination of the people will actually hold. And so as we don't know those factors, it's very difficult to make a serious prediction on a timescale of longer than 4 weeks.
Let me bridge back to the first keynote today. We heard from Professor Ilona Kickbusch. I'm not sure if she's still with us, but we had this very interesting question to her. So because Christmas is coming very soon, and if you had a wish list, what would you wish for in terms of democratic societies, how we could improve our pandemic resilience, what would be on the top of your wish list?
So Christmas is considered by most people as a danger. That's something that I'm not sure that I want to share that point of view. It might well be a chance. But in order to be a chance, you have to see that during Christmas time, most of the work activity is stopped. It's kind of a lockdown situation. So there is shops open, and if you stop exchanging your Christmas presents at that occasion, you might even have a relatively calm situation there. So there is actually mostly a lockdown, and people stay at home. The groups in the homes are larger than otherwise. So the household size is kind of increasing, if you want, in our simulation. And this situation is the danger. Yeah. So because if you have 3 households and on 24th you do it at home, on 25th you go to your parents, and then on 26th you go to the parents of the other partner, and every time you bring the children. And luckily now they were out of school from the 19th. So, but it still bears the risk that you distribute something. And there is the thing. And we should, so my take is, it's a celebration of charity. This is the topic of this Weihnachtsfest. And so Christmas should be seen as that. And, the last thing you want to have is that you feel guilty of having infected your grandpa on that occasion. This is not what you want to do. Yeah? So this is something that we should avoid at any price, and we have to see how to do that without isolating the grandpa on the other side. So this is the balance that we have to find, to have the social interaction, but protecting each other still, and thinking about that we might be infectious at any time. I would say if we think of that and we don't go for the New Year party, we have a real chance to make this a progress in the numbers rather than an acceleration of the pandemic.
Yeah, thank you so much, Professor Meyer-Hermann, for this insight and this discussion and sharing your knowledge there and the results of modeling with all its limitations. I think a very key point we take from that is that both in terms of the epidemiological realities, but also in terms of the social and political realities, we have still a lot of hard choices to make, and it will be quite difficult, both in terms of our awareness, in terms of mindsets, to achieve a better health security for the populations around the world. With that, I'd like to come to a conclusion, not only for this last segment with Professor Meyer-Hermann, but also for the entire conference. And it truly has been exciting, but also very sobering discussions and interventions. I have the honor to try to come up with some summary of that special focus day on health and security of this year's International Security Forum Bonn. Of course, it's impossible to summarize all the rich insights from our distinguished speakers. So please allow me to come up with a couple of takeaways in a condensed form. What can we learn from the pandemic? First of all, bringing health and security together requires definitely a more comprehensive and integrative approach to security. One element of that is a multidisciplinary perspectives ranging from law to virology, but also from computer-based modeling to qualitative research. All of them are necessary to tackle the pandemic on the one hand, but also to improve our resilience, our preparedness, infrastructures of response for future epidemics. Many speakers have agreed that policymakers have underestimated the magnitude of the threat, and that many Western nations in particular experience a failure of health security policy with massive consequences. That countries in Europe and in North America could become the center of the epidemic crisis and suffer that much from the consequences was simply not imaginable for many policymakers, but also for many normal people. The third takeaway is certainly the need to be open and to learn from experiences elsewhere, especially from Asian countries, but not only from there. Also, the control of microbes is an issue as old as humanity. It was somehow forgotten in the West, especially in many Western countries. And our cognitive map is outdated. Also in Europe, I think we had the problem of a very inward-looking approach in the beginning. So clearly, best practices from different contexts, from various countries, ranging from health screening to testing to contact tracing and medical treatments, but also to community-based action, the role of digital technologies and expert advice and so forth. All of those need to be studied in a very close and nuanced way. There is a lot of room for improvement when it comes to various democratic practices and measures to contain the pandemic, and also to rethink the nexus of collective and individual attitudes. The main point of learning, however, is not the divisive issue of whether liberal societies have to become more authoritarian or more state-centric. In fact, there are many democratic societies in Asia which have a comparable civic culture and political systems to provide ample examples we could emulate here in Europe and also in North America. It has been pointed out that the lack of immediate experiences with a large-scale pandemic in Europe and the US have led to a low level of awareness and a lack of appropriate preparation. It is important, therefore, to institutionalize the preparedness and different measures, also legal frameworks and so forth, to be better prepared for the future. But also, has been pointed out by many speakers, that we need a new kind of mindset that will prepare us better for future infectious diseases. Future health security policies, in that sense, need both a 360-degree vision, which is inclusive to many different policy fields, but also collective imaginary of the good life, of the positive future we want to achieve. In that sense, I would agree with Ilona Kickbusch, who said in the beginning that it's not just building back better, it's building different better for a different kind of societal future. Another element of this preparedness or pandemic-proof approach is to change our mindsets, especially on the individual level. And that was, I think, what Michael Meyer-Hermann was also pointing out at the end of his intervention. Notions such as altruism, solidarity are key for having a different attitude on the individual level to prevent further pandemics. It also comes already into play with the progressing vaccination, which could lead to an unwanted effect of prolonging the pandemic if it decreases the compliance in terms of social distancing and wearing face masks and so forth. On the international level, despite decades of negotiations and the best efforts of the WTO, we still lack a functioning governance system that has been pointed out by many experts during the day. A reason that coordination remains weak during COVID-19 is also the rise of nationalist competition for the better strategies, for the more successful approach and so forth. And it's very crucial to avoid this kind of narrative battles and focus to the concrete policies to improve the situation. Certainly, geopolitical tensions, as has been pointed out, especially between the US and China, are driving a lot of the public rhetoric and diplomacy. The pandemic crisis naturally accelerates geopolitical trends. Yet the narrative of triumphs of a certain political system or others, for instance, of a certain political countries having a faster vaccination development, are purely motivated by politics. This kind of politicization hurts the efforts of collaboration and coordination of effective measures, but it also hinders us from learning from successful strategies and best practices. A good security practice, to paraphrase Simon Dolby's input in the morning, is about preventing dangers from getting realized, from manifest themselves, and not responding towards them after they have actually happened. And to realize that kind of approach, the organization of health governance, both via regional approaches, such as within the European Union, but also the African Union, for example, and also on a multilateral level, remains and needs more pushes forward. The proposed International Pandemic Treaty offers a grand vision for this purpose, including new ways of financing measures on a global level. To organize the funding of global health measures and the equitable provision of global health goods is a central problem to be solved now, and I hope from the pandemic we are getting a push in really achieving that. The European Union especially could play a leading role with regard to these efforts. The promise of international solidarity, which has suffered a setback due to the pandemic nationalism in all its ugly forms, will be tested very soon again with the coming tasks of the global distribution of vaccines against COVID-19. With these brief notes, I conclude our conversations today. The topic of COVID-19 and health security will stick with us, and I hope from the many experts we brought together today that there will be also sustainable networks and further collaborations stemming from that event today. I'd like to express my gratitude to the audience for sticking with us so long. It's been a day packed with dense expertise and debates, so thanks for keeping with us. Thanks so much to all the panelists and moderators for sharing their experience and their wisdom with us. And finally, thanks a lot to all my colleagues at the Center for Advanced Security, Strategic and Integration Studies at Bonn University, as well as the technical support team for a truly wonderful job of running this virtual event and accommodating everyone smoothly. I wish you a good evening.